Now we will discuss regarding the topic on inguinal hernia, how to take a history on inguinal hernia. In this topic, we will be taking reference from various books like Bailey and Love, Savistan, Raja Mahendran sir's Long Cases in General Surgery, and Bedside Clinical Surgery by M.L. Saha sir. Now, first of all, you have to know about the definition of inguinal hernia. So the definition is, it is the abnormal protrusion of part or whole of viscous through a normal or an abnormal opening through the wall of the cavity that contains it. It means, if suppose I am having a wall here, and here is my viscous, if it is pushing and it develops a defect, here is the skin, and due to the presence of the defect, the part of the viscous can come throughout, then this is the hernia. Now, whenever we are taking the history of a patient, it will always start with the patient particulars. And in patient particulars, the thing we should be concerned about is the name of the patient. Always address the patient by Mr. or Mrs. or Master or Miss in all types of history. After that, the age of the patient. Now, why is it important? The age of the patient is important because young age, it is usually indirect hernia. In old age, it is usually direct hernia, but it is not a hard and fast rule. After that, we have to know about the gender of the patient. Now, why is gender important? Because male is to female ratio for inguinal hernia is 10:1. Same it is 1:10 for femoral hernia. So gender is important. After that, we have to know the occupation of the individual. Now, why is occupation important? Occupation is important because in many occupations there will be increase in the intra-abdominal pressure. But this has been disproven in latest studies. What has been disproven? That occupation in which the intra-abdominal pressure is high, these cases will have increased incidence of hernia. This has been disproven now. It has been found that the incidence is almost similar in all types of occupation. Okay. Now, what will be the chief complaint? After that, we have to proceed with the address, the date of admission, and the date of examination. After that we proceed with chief complaints. Now usually in MBBS level, the chief complaints will be usually a swelling in the groin. In MBBS level, usually obstructed cases or irreducible cases are usually not given. Only reducible cases will be given, that is those hernia which are easily reducible. So swelling in the groin, mind it, we are using the term groin and not a inguinal region, because you have to use language used by the patient and no scientific terms are to be used in chief complaint or history of present illness. Okay, so mainly chief complaint is swelling in the groin, and after that you have to write for this much duration. Okay, now suppose I am telling that a patient is there who is presenting a swelling for 8 years. So swelling in the groin for 8 years. Now history of present illness. In this case, the main things that we must address are patient was apparently well. This much duration you have to mention. This much duration back, after which he or she noticed a swelling in the dash groin. It may be right or left or bilateral. Okay. Now certain things about the hernia you have to mention, which are: first we have talked about the duration. Now secondly you have to talk about the onset, whether it was sudden onset or it was gradual or insidious in onset. Now most hernias are insidious in onset, but sudden onset is usually post surgery or trauma. That is because of break in the continuity of the overlying structures. Okay. After that you have to mention about the site of origin, from where it started. Okay, for example, if it is from, suppose this is the right side of the patient and this is the inguinal region and this is the scrotum of the patient. Okay, if the hernia originates from the groin and move towards the scrotum, then it is hernia. If the swelling originates from the groin and moves towards the scrotum, then it is a hernia. On the other hand, if it originates from the scrotum and move towards the groin, then it is hydrocele or a varicocele. So this is a hernia, whereas this can be a hydrocele or varicocele. So here we are just talking about the history, but this is important when we are when we are examining the case. While examining, if we are seeing that the patient is having what we say, that whenever we are palpating in this region while examination, if we are palpating in this region with our fingers, what will happen? This swelling, what we just mentioned here, what will happen? This swelling will come like this, the groin. So it will not be possible to get above this swelling. So here getting above the swelling is not possible. Whereas here, getting above the swelling will be possible. Will be possible. But mind it that these are not to be mentioned in history. This will be mentioned only in the examination part. Okay, so we have talked about the site of the origin. Now we have to talk about the aggravating factors. What are the aggravating factors? Main aggravating factors are any factor which will increase the intra abdominal pressure, like straining. So when do you strain? While constipation or difficulty in passage of urine. Also, increase in abdominal pressure occurs during coughing. Other aggravating factors are predominantly standing. So these are the main aggravating factors. Now relieving factors. Unlike other diseases where medicine plays a key role in relieving the symptoms, here it is mainly reduces spontaneously in case of direct hernia, and manual reduction needed by the patient in case of indirect hernia. Okay. After that, you have to mention whether a pain is there or not. If pain usually absent. If pain is present, what does it signify? It signifies either it is irreducible or it is obstructed or it is strangulated. These are the main causes of pain. Now, after this, you have to say, if the patient is having pain, then you have to rule out all these things. Now, what do you mean by irreducible? Irreducible means, suppose this is the hernia you are seeing, and inside this is the sac. So we can see the sac now, and suppose this is the bowel content. So this is the bowel. So the causes of irreducibility are, first of all, there will be adhesion between the contents. Okay, this is adhesion between the contents. Next, there will be adhesion between the sac and the content. So this is the sac and this is the content. It's adhesion between the sac and the content. So these are the main reason. If there is adhesion between the sac and the content, and also adhesion within the content. So this is adhesion within the contents of the sac, and also adhesion of sac with the content. Okay, now we come for obstruction. Now how does obstruction present? Obstruction means it is irreducible, and along with it the patient has developed signs of obstruction, intestinal obstruction. Okay, now what are the difficult signs of obstruction? We know they are colicky abdominal pain, then vomiting, then abdominal distension. In prolonged condition there will be obstipation. So if we are getting all these symptoms, then it is a obstructed inguinal hernia. After that comes strangulation. Now what does this strangulation mean? Strangulation means, again, it is irreducible, which has now progressed to obstruction, and now there is arrest in the blood supply, which means there will be gangrenous changes, and due to this gangrene the patient will have tense, tender hernia, and also this gangrene will cause sepsis in this patient. So the patient will have fever, tachycardia, and in advanced cases there might be altered sensorium due to the sepsis. So these are the common: irreducible, obstruction, and strangulation. After that, we have to ask for any precipitating factors. What are the precipitating factors I told? Any difficulty in defecation or micturition or cough. Difficulty in defecation, micturition, or chronic cough. Now chronic cough can be due to COPD, it can be due to asthma, it can be due to TB in tropical scenario. Okay. Usually another history that was taken was whether any surgery had been done or not. Okay. History of past surgery is also important, because once a surgery is done, and even if best possible healing of the wound has occurred, then also only 70% strength is gained back. Okay. Also, previously history was taken that any history of appendicectomy has been done or not. So whenever it was old concept that appendicectomy causes injury to the ilioinguinal and the iliohypogastric nerves, and these predispose to the formation of direct hernia. This concept has also been disproven now. So some old examiners might ask this question, only then we have to answer this, otherwise no need to answer this from our end. So after the history of presenting illness, what does it have? Let's recapitulate. Duration, onset, site of origin, aggravating factors, relieving factors, whether pain is present or not, and whether any past history has been there or not. After that we go to past history. Regarding the history of surgery, that can be put in past history also. Past history, what you are asking about past history, it is whether the patient is a diabetic, hypertensive, asthma, COPD, any ischemic heart disease, or TB. We have to ask all this. Also any history of previous surgery. Now we have to go about family history. Now why family history is important? Family history is very important because hernia is a defect in the muscle or defect in the connective tissue. So there are many diseases which are transmitted as familial diseases like connective tissue disorders. Some examples are Marfan syndrome and Ehlers-Danlos syndrome. We have to take this history, that whether any member in the family is having such hernia or not. Now comes personal history. In the personal history, what we have to ask is sleep, bladder, bowel, appetite. Now in this case, sleep is usually normal. If the patient is having any difficulty in micturition or defecation, that has to be mentioned here. And usually the patient's appetite is normal. So what we have to write is patient consumes either vegetarian diet or non-vegetarian diet or vegan diet, and the appetite is normal, that we have to mention it. After the personal history, we have to go to addiction history. Here addiction history is very important. Why it is important? Because we have to consider whether the patient is a smoker or not. So first we have to write whether the patient is smoker or not, and also mention number of pack years of smoking. Now why smoking causes cancer? Smoking causes hernia. The first is that in case of smoking, the patient will develop COPD and there will be chronic cough, and this will lead to hernia. Secondly, smoking prevents maturation of collagen. So there will be immature collagen. This will produce weak musculature. Together they cause hernia. Okay. Now after personal history, now we are going to examination.